Surrogates are more likely to have hypertension and postpartum hemorrhage. In this study of 938 singleton pregnancies, including 956 women acting as surrogates for intended parents, found that these women were more likely to be older, have had children, reside in low-income areas, and have chronic hypertension when compared to other women in the cohort. Now, this study shows that gestational surrogates are at an increased risk of serious complications in pregnancy. This highlights the importance of careful screening and counseling of surrogates. Now, surrogates were found to have a 14.9% risk of hypertension and postpartum hemorrhage compared to the 11% or 12% risk that respectively for women who have had a baby following IVF. So there seems to be a huge difference. Now, women conceived naturally experienced a 6% risk of postpartum hemorrhage and a 7% risk of hypertension. The cohort was followed between 20 weeks of gestation and 42 weeks after delivery. 1 in 14 surrogates experienced severe health conditions linked to their pregnancy and birth compared to 1 in 22 women giving birth following IVF and 1 in 42 women who conceived naturally. So just have a look at the risks that surrogates may be having. Gestational carriers are also likely to be less likely to be in the highest income bracket, and we know that low socioeconomic status is associated with higher maternal morbidity. Now, if you consider all these facts, that surrogates are more likely to have previous pregnancies, be older, it is important to ensure that any woman who is intending to be a surrogate is both medically assessed and considered fit for pregnancy and given the opportunity to have implications counseling where all the risks, including health risks, are made. And this is known to her prior to her going on and going on with treatment. And she understands this risk and then consents to continuing the surrogacy treatment. Her decisions then should be respected. But it's very important that you go through the risks that a surrogate may be having, because if you see, there's more and more data coming out that the risks also can be higher.